Patients who are wondering how many low-tech treatments they should attempt before moving on to IVF, and most doctors think that IUI, or intrauterine insemination with gonadotropin support, should be attempted maybe no more than 3 times before moving on to IVF. And most women, although not all, but many, if they're going to conceive through IUI, will do so within 3 attempts before moving on to IVF. And a lot of women wonder about this, but if they move on to IVF, sometimes they get a faster result and at the same time more cost-effective than if they just stay with too many IUIs. So sometimes IVF is the best route in the long run. There are a number of psychological roadblocks that would prevent a patient from moving on to IVF. There are a number of concerns and fears, and women sometimes don't know exactly where to proceed or how to get through those roadblocks. I'm speaking today with Linda, one of my former clients, about talking about moving into IVF and different treatments. Do you sometimes feel like you're kind of at a crossroads and you're not sure which way that you're going to go from here?
Yes, I'm scared. I don't know. We've had so many disappointments, and I just don't know if the next thing is what it's going to bring, if it will ultimately bring a baby, which is obviously our wish, or just more disappointment. There's several things that I'm concerned about moving forward.
Well, the stress and anxiety is very real, and it is a very normal reaction to the sort of decision point that you're at right now. That feeling of being at a crossroads, that feeling of having to make a decision, and the feeling of maybe time is ticking on and running out, and you feel like you have to do something. You have to